Сайн байцгаана уу хүн үзэгчдээ. Өнөөдөр манай Defacto нэвтрүүлгийн зочноор доктор Goodman оролцож байна.
Лаура Гүүдмэн, Нийтийн эрүүл мэндийн судлаач, эмч. Америкт нэгдсэн улсын Питтсбургийн их сургуульд 2012 онд анагаах ухааны чиглэлээр бакалаврын зэрэг, Харвардын их сургуульд 2017 онд Нийтийн эрүүл мэндийн чиглэлээр магистрийн зэрэг хамгаалжээ. 2004-өөс 2005 онд Америкт нэгдсэн улсын инх тайвны корпусын сайн дурын ажилтнаар Увс аймагт англи хэлний багшаар ажиллаж байсан. Тэрээр хөдөө орон нутаг, аслагдмал бүсүүд дэх эрүүл мэндийн тусламж, үйлчилгээний хүртээмжийн асуудалд анхаарч ажилладаг бөгөөд энэхүү ажлаараа Салли Миллерийн шагнал хүртсэн. Америкт нэгдсэн улсын Fulbright-ийн тэтгэлгээр 2016 онд Монголд ирж, Монголын судлаачтай хамтран нийтийн эрүүл мэндийн чиглэлээр судалгаа хийжээ.
Hello.
Hi, thank you for having me.
How was your trip? What was this trip about by all around Mongolia?
Yeah, it was a wonderful trip. I'm really lucky to be here and to be able to make this journey. I was traveling with a group of teachers who are doctors at the Medical University of Mongolia, and it was a joint research project with a teaching aim. So the reason I came to Mongolia was to conduct research with the goal of improving access to pediatric surgery for children in Mongolia specifically. This trip was part of a series of trips to visit each IMEG and visit each IMEG center hospital and conduct assessments of what the hospital has in terms of personnel, the doctors, the nurses, the equipment, if they have the equipment they need to do the surgery for children who need it. Children might need surgery because they have an accident, they fall off a horse or in a car crash, or they have a simple appendicitis, or even if they're born with something like cleft palate, cleft lip, or sometimes other conditions that require surgery. So we looked at those things, also the infrastructure, the operating rooms, the supplies that they have, with the goal of setting out the capabilities, but also the areas where there could be improvement. Because with the knowledge, then you could make improvements and make sure all the kids can get what they need.
That's so important because it's such a vast country, and a child needs very quick access to whatever is first aid they need.
Yeah.
So you said in each IMAC, have you visited all IMAC now?
So the team has. Unfortunately, in the fall, right before the first trip was to begin, I was at a meeting in Washington, D.C., and I broke my leg. So I experienced firsthand surgical care, but in the United States, not here. So the team that had assembled, it was really Dr. Erden Setzig who took the lead from the Medical University, and she established a team including anesthesiologist Dr. Burma, and laparoscopic and general surgeon Dr. Sanchin and their residents. And the team was ready. The team had already sent letters to the hospitals in eastern Mongolia, central, northern, and southern. And so while I was laying on my back in Washington, D.C., they went anyway.
So in a way now the team had visited all IMACs.
Yes.
Now you can more or less have something to say about that level you wanted to know. So what is the state of that hospitals in the IMACs?
Yeah, they're really different. There's a variety of, they're all secondary hospitals, meaning they have surgery capabilities and general surgeons. Very few of them have pediatric surgery specialists, and few have additional surgical specialties like maxillofacial surgery, ophthalmology. They have very dedicated and technically skilled surgeons, but there are gaps almost everywhere. So there's, as we would expect, more resources available in Ulaanbaatar than there are in the countryside. I didn't find any overall trend as far as any one region being better equipped than the others. The northern regions with Seleng, Imeg, Darhan, Orkhon have a trend toward higher resources. They're closer to Ulaanbaatar, They've traditionally been more developed, but the difference between that region and the others is not statistically significant.
Statistically significant. Yeah. What are those, in general I understand access to resources, different human resource, maybe physical, technical, right. But in general, are there any urgent matters that we have to pay or the government has to take into action immediately? Yeah,
the team that I've been working with actually has done an additional assessment that I think addresses that really well. So they did a SWOT analysis, a tool from business, looking at the positives and negatives, areas for improvement at each site from the perspective of the people who work there. And that really, I think, gets at the most urgent matters. And they've taken these findings to already some of the local administrators, hospital directors, and we plan to present it to the ministry hopefully within the next month.
Will it be any sort of report that publicly available?
Yeah, that's the other part of it. So the data that we've gathered in the forms that I came with from the US, it's called a PD Pipes assessment, and it includes the personnel, infrastructure, procedures, equipment, and supplies at each hospital. And that will be, those are the numbers that I've looked at as far as comparing regions. It's comparable across even countries. That will be published in the medical literature, and we'll write a press release for the public as well. Then the doctors here will also create shorter reports on each region for the Mongolian medical literature, for the doctors and nurses especially.
Okay, so with that concept, let's go to your connection with Mongolia back from 2003 and 2004 as a Peace Corps and teaching English. Please tell us about that. Why? Why Mongolia?
Yeah, at first I had applied for the Peace Corps and said I wanted to go to Asia. I'd never visited Mongolia before. And the Peace Corps called one day and said, we have a job for you and for my husband. We were coming together in Mongolia. Do you want it? And my first reaction was yes. Okay. I don't know anything about Mongolia, but yes, I'll go. So we signed up and did a little bit of research, but we arrived in June 2004. And I had a crash course in Mongolian, staying with a family in Salang, Imig, and learning to speak every day from the level of a child. You know, at first, I didn't know how to say, you know, I need to use...
You were living alone in there, Selengamag, in a Mongolian herdsman family, or?
It was in a som.
Som, which som?
Baronhara.
Baronhara, okay.
Yeah. I was with my husband and staying with a family with two sisters who we're very lucky to still be in contact with today. And they were just very generous and patient, teaching us, again, like children, how to say the most basic things. So we learned about Mongolian life and culture through the summer, had a crash course in becoming teachers. My background was in cultural anthropology, which was useful for understanding and adapting to life, but my skills with English are being a native speaker, and that's it.
So you have been teaching in Samoan English?
After that, we moved to Ovs, yeah, in Olangom. And I was a teacher in school number 4 there. Also
Olangom is the center of the Amag.
Yeah.
School number 3?
4.
School number 4.
Yeah.
And what was in general, your impression about that teaching period in Ovsaimag?
It was a good experience for me. I think not as good for my students because because I wasn't a trained teacher. I had a crash course from the Peace Corps, but my counterparts, you know, had a degree in teaching. And here I was. I can speak English, I can write English, I can do that, both things correctly, but to tell you the reasons why, to explain the grammar, it's a little bit more challenging for me. So out of that experience, developing the connections with the teachers, being a person that the students could know as a foreigner, perhaps was good for them. For their English improvement, maybe not as much.
How many students were in your courses?
I had around 40 students in most classes. Yeah, it's grades 5 through 10.
You have been visiting recently also SIMAC, right?
I have, yeah.
So you have, say, had a chance to see the SIMAC with some over 10 years, dozen years of period, space. So what was your feeling, and can you compare somehow?
Yeah.
Is it any improvement? What was your thought?
Yeah, it's changed a lot. It's so different. It's very developed. It's very clear that a lot of money has come into Wollongong compared to before. There are new hotels, new apartments. Peace Corps volunteers who I've talked to there have a very different experience in their lives than I did living there. At the time, a dozen years ago, as you said, life was not so easy.
Yes.
As you know, it's one of the coldest IMEX, and our apartment was cold, and there wasn't hot water. The modern conveniences that
they have it now.
Yeah, that they have now weren't available then.
So our country is moving a bit ahead with physical, say, infrastructure, buildings, more or less. Not all even, but things go ahead. But have you seen other social changes? People become poorer, or inequality, or what was your feeling? Other observations?
Yeah, the economic development doesn't pull everyone up, of course.
Okay, so you left 2004, Mongolia 5, right?
5.
And went back to Pittsburgh.
First to Arizona, then to Pittsburgh. I've moved a lot, yeah.
Okay, so how come you are now becoming more related to medical part? Was it initially the intention, or what happened?
Yeah. When I came to Mongolia the first time, I didn't know that I would go into medicine. Like I said, I studied anthropology, and so I hadn't done the preparation in college that's required for medical school. It's required that you take 1 year of physics, 1 year of chemistry, a year of organic chemistry, a year of biology, before even entering medical school. So I had come to the Peace Corps thinking I can make a difference in the world, like many Peace Corps volunteers believe, by being a good person. I don't know. I thought I would.
Let's go more details on this. In the U.S. now, let's talk about the medical school system in the U.S. And you said now, 4 disciplines, you should go within a year or 4 years?
Within 4 years. First, a bachelor's degree is almost always required.
Okay.
And that must include those 4 topics.
Which is?
Physics for 1 year, chemistry for 1 year,
chemistry,
organic chemistry for 1 year, and biology for 1 year.
Okay, biology. So
they can be done at the same time.
At the same time, but the year-long courses of these 4 disciplines within your bachelor degrees.
Correct.
Okay, bachelor degrees must include these disciplines.
Yep.
Then now you finally enter into medical school.
Right.
So how long this school goes?
After those prerequisites, which for me were 2.5 years, I had to also take the entrance exam. Then medical school is 4 years.
4 years.
Yeah.
Okay, then what do you study there?
And so that's a general course. It's the same for all doctors.
Okay.
And you have to pass the licensing exams as a part of medical school.
At the end?
In the middle and at the end, yeah. There are 3 different parts.
Okay.
Yeah. So the first part is completed after the first 2 years of medical school.
Okay.
It covers basic sciences, the understanding of anatomy and physiology, biochemistry, etc.
Okay.
And then at the end of or in the middle of the 4th year, after starting clinical interactions, then there's a 2-part second step, which has more applied medical
So
sciences.
after 4 years, you still go again?
And then again, third time.
Yeah, third time is what?
Third time is after 1 year of residency. Then you can take your 3rd exam.
After 1 year residency, again you do exams.
Exactly. then you can have a license as a medical doctor to
Let's
practice
talk about
generally.
residency.
That means you go to a hospital and work?
Right.
And by that time, it's still, when you are as a resident, you have no right to or have a surgery on a patient.
Not independently.
Okay, you are with somebody,
Yes.
but not as a first player.
Right.
Okay, so kind of 1 year residence you have. Then altogether what? 4, then 5, right? 1, so altogether at least 9 years
Right.
to have that license, right?
Right.
9
Medical
years.
license to be a general doctor.
What is the medical license about?
You can
What you can do with that?
Yeah, you can prescribe medicines.
Okay.
You could work in an emergency type situation. It's called an urgent care
Okay.
in the United States, where it's taking care of simple conditions, people with a sore throat, other infections, conditions where they are sick overnight or something where they can't get in to see their normal doctor. But it's not a full license. Like, for example, to be a general surgeon requires 5 years of residency in total.
Oh man, so this is you said general physician, no?
General doctor.
General doctor, which you are now.
Yes.
It takes another year or 5 years.
So a general doctor is 1 year after medical school.
Okay.
To do a general surgery, to be a surgeon, it's 5 years after medical school.
Wow, so 5 years.
Right.
Well, altogether what? This general surgeon, well, this is another 5 years, the residency.
Yeah.
Mine. Then a person in the U.S. who has the general surgeon surgery certificate or license has already 5 years practical training.
Right. So they can operate independently.
Well, in
Once-
Mongolia, I think they go immediately somehow.
I think
What do you think?
I think the model is very different. I think so. Because it's too many years to count from bachelor's, it becomes too
Yes.
much. So for medical school, after medical school, for me, it's 5 years. Plus, I'm doing this year in Mongolia in the middle, and I did another year for my master's also. So it's actually 7 years after medical school. Then I can be a general surgeon, work independently. I've talked with colleagues at the Children's Hospital here, and they've done 2 years after medical school for residency, plus 6 months for pediatric surgery. And then after that, they work together with their more senior colleagues, always together, not by themselves, for 7 or 8 years, and then they take an exam, then they can work alone. So it's actually, they're working 9 years, which for me, it'll be approximately the same, right? 7 years for general surgery.
So you find Mongolians still about a similar system of experiences?
I think so.
Well, okay, let's assume so. And so your plan, are you general surgeon already?
No, so I've completed the first 3 years of general surgery, and then 2 years for this master's. When I return to California, I'll have 2 more years of general surgery.
So that's your plan.
Yeah, and then pediatric surgery.
Okay, so you want to be a general surgeon and plus pediatric surgery
Exactly.
for the children, the surgery.
Yes.
And why?
Because you have the potential to make the most difference in kids. So
Most
they have
difference, okay.
their entire life ahead of them. Where if you can do an operation on a child, even something simple, fixing a fracture, taking out their appendix, they have their
Yes.
entire life to live. And they
Right.
recover usually quite well. You do an operation on someone who's maybe 92 with some problem, their potential to recover is much more limited. They're already at risk for having an infection in the hospital.
Yes, whole life is ahead for the children.
Exactly.
So that's why you make this research, and you became Salli Miller Award scholarship, right? For services. What is this about?
This connects back to my interest in working for services for people who don't have access to them. So in medical school, I thought I would be a family doctor. It's only 3 years after medical school. And I thought that I could work with people in rural areas who don't have access to a doctor. Bring services to people who need it most, who can't travel, things like that. So when I was in medical school, I helped organize some of my fellow students into a service trip during spring break. A lot of people will go overseas to do work during spring break, do very short-term missions. And there are really good parts of missions. They can bring services to patients who wouldn't have them otherwise, but there's a problem with sustainability. How will those patients be followed up? How will they get care once the visitors are gone? So that work in rural areas got me interested in issues of access. And when it became possible for me to come back here, I'm seeing some of the same issues of patients being too far from the main hospitals to get care. They're not seen often by people in positions to do something about it. It's an almost invisible problem in a lot of places. And it's a common problem to the United States, to Mongolia, to countries in Africa. There are many people in rural areas, especially herders, people who are farmers, who need to be able to get care, especially surgical care, who can't get it. So that award at the time for me was just a recognition of the work and the commitment that I had to work on care for people who didn't have it.
So your Peace Corps experience gave you the picture of the remoteness of the Western Mongolia.
It did.
And probably the first thing to come to your mind about this underserved children.
Yeah.
Well, a good cause. And now you are a Fulbright scholar.
Yeah.
Please tell us about that.
Yeah, that has been an incredible opportunity. I took almost a year to apply for scholarships and fellowships, knowing that I wanted to do this work. I was really lucky to meet people who introduced me to Dr. Ray Price, who's worked here for almost a dozen years with Dr. Sergelsen at the Medical University. And she was able to introduce me to Dr. Erdensetzig, the pediatric surgeon that I've been working with. And it's really through their support that I was able to develop this idea of working on pediatric surgical capacity. And then I applied for the Fulbright through Harvard University because I am still a student there in the Master's of Public Health program. So with the help of advisors there, I was able to apply, and it's given me an opportunity to, one, be here, but also meet people that I wouldn't normally meet through the embassy and through other programs like that.
So how things go so far compared with your planning?
It's been very different. It's been great. I couldn't have anticipated having a team like we've been able to have with the surgeons teaching and conducting their own research. So it far exceeds my expectations in that sense. I think that this is improving the capacity in Mongolia to do research here that's based here. The problem I see a lot is that researchers, again, like missions, will come in for a short time and leave. So I want to increase the capacity to do work from here.
Please tell us about the public health, why public health is so important.
Yeah, it's not that common as a physician. You're focused on the individual patient. It's not that common to go back and focus on the population level. But looking at public health, studying epidemiology, which is what I'm focused on, enables people to get the perspective of the whole society and population to understand what barriers there might be to reducing childhood mortality, to improving life expectancy, to improving quality of life. For me, studying public health was almost like going back to anthropology in the sense of having a broader perspective. I went from focusing on just one patient at a time, fixing one thing, moving on through each day, but having a very small, narrow, on-the-ground focus, to, during this public health study, being able to look up around and kind of see the entire picture. I don't have solutions for Mongolia, but I hope that this research can bring some of the problems into the open so that solutions can come about.
Then from that perspective of health at the population level, how do you see a situation in Mongolia?
My interaction with the public health professionals in Mongolia has actually been somewhat limited to this point due to my own doing, I think, that I work with surgeons in the United States and I mostly work with surgeons here. So I think that I've seen some good reports coming out of UNICEF, and I know the public health school is quite active. So I think there is work happening on that level. Mongolia has been an example, actually, from the surgical public health perspective, improving access to emergency surgical care. It's an example that the World Health Organization brings up again and again, but there is always room for improvement everywhere. So,
with this childhood mortality, we had at certain times bad practices, situations, and somewhat it is increased. Would you agree?
That the mortality is increased?
I mean decreased.
Decreased.
But there was a certain time when it was very high.
Yeah, especially after the transition to the free market economy. Right, it was very high. That was about 1991, 92. It's improved drastically since then. There's been a
Now still a big issue with the sanitation.
Yes.
That reflects on not only child but everybody's health situation.
Yeah.
And we, with a little investment, could improve sanitations, in particular in dorms.
Yes. Yeah. That was a challenge in the school I worked in Olangom. When I was there, there was no place to wash our hands. The toilets were outside.
Have you seen it now? Is it changed?
I haven't been back to the same one, but I know, in Gare areas, it's often the same situation.
Yeah, I mean, this is still half of the population is living in this, unfortunately, bad areas.
The other aspect of the Gare areas that relates to health and to child health in surgery in particular is the air pollution.
Air pollution, yes.
And that is something that
it's all around, even in IMAX, right?
Exactly. In the IMEG centers, even indoor air pollution from cooking over solid fuel, over the coal inside a Gare, even that impacts on child health. But the thing that concerns me the most right now is the outdoor air pollution that sits in Ulaanbaatar just all winter long with the inversion effect, the coal smoke. Just lingers, and it leads to lower respiratory tract infections. Sometimes they go so long without being treated, children have to have surgery for it. It has been associated in other countries with congenital anomalies or birth defects. I haven't been able to show that here yet, but it's one of the things that I'm looking at.
That would be very good towards having found any solutions of these very urgent problems all around the country, in particular in Ulaanbaatar. Laura, it has been a great pleasure to know what you do in Mongolia, how you are connected with Mongolia, and looks like it will be connected a lot with Mongolia. Thank you very much for the job you're doing.
Thank you. Thanks for having me.
Thank you. Хүн үзэгчдээ өнөөдөр манай Defacto нэвтрүүлгийн зочноор Harvard-ийн оюутан мастер хийж байгаа доктор Goodman оролцлоо. Баярлалаа.